Hello everyone. In this podcast, you will understand about the autism spectrum disorder, which is also known as autism or ASD. Autism spectrum disorder is a developmental disability caused by the differences in the brain. People with ASD often have problems with social communication, social interaction, non-verbal communication, and restricted behavior or repetitive behaviors. People with ASD may also have different ways of learning, moving, or paying attention, which means the abilities of people with ASD can vary significantly. For example, some people with ASD may have advanced conversation skills, whereas others may have advanced non-verbal skills. ASD begins before the age of 3 years and can last throughout a person's life, although symptoms may improve over time. Some children show ASD symptoms within the first 12 months of life. In others, symptoms may not show up until 24 months of age or later. Some children with ASD gain new skills and meet developmental milestones until around 18 to 24 months of age. As children with ASD become adolescents and young adults, they may have difficulties in developing and maintaining friendships, communicating with peers and adults. Every children with ASD have problems with social communication, social interaction, and restricted or repetitive behaviors. However, your children might have autism spectrum disorder if they have the following signs and symptoms, like if your child avoids or does not keep eye contact, does not respond to name by 9 months of age, does not show facial expressions like happy, sad, and angry, does not play simple interactive games by 12 months of age, uses few words by 12 months of age, does not notice other children and join them in play by 36 months of age, lines up toys or other objects and get upset when order is changed, repeats words or phrases over and over, which is also known as echolalia, plays with toys the same every time, gets upset by minor changes in their life, must follow certain routines. Other signs and symptoms of ASD include delayed language skill, delayed movement skills, delayed cognitive or learning skills, hyperactive, impulsive and inattentive behaviors, unusual eating and sleeping habits, unusual mood or emotional reaction, anxiety, stress or excessive worry, lack of fear or more fear than expected. Some of the risk factors of autism spectrum disorder are: firstly, gender. Boys are about 4 times more likely to develop autism spectrum disorder than girls. Second, family history. Families who have a child with autism spectrum disorder have an increased risk of having another child with autism spectrum disorder. Third, other disorders. Children with certain medical conditions have higher risks than normal risks of autism spectrum disorder or autism-like symptoms. Fourth, preterm babies. Babies born before 26 weeks of gestation may have a greater risk of developing autism spectrum disorder. Lastly, parent age. There may be a connection between children born to older parents and autism spectrum disorder, but more research is necessary to establish this link. So lastly, if your children have autism spectrum disorder signs and symptoms, I would like to recommend you all to avail the medical services as soon as possible. Thank you.